Hello everyone, welcome to an organization where we groom innovation, design future, celebrate ideas. We are the infrastructure backbone of Northeast, where hard work, innovation, and quality matters. We have been successfully leading the industry since 1984. Here is a brief history.
To our first plant at Guwahati.
Good morning and welcome everyone. I am Dr. Jyotishri Pinaka, CEO of the American Academy of Yoga and Meditation. I'm a nephrologist and also a transplant nephrologist. A little few words about our organization, AAYM. We are a not-for-profit organization on physicians, researchers, medical professionals, and practitioners of yoga and meditation. We are dedicated to education, learning, and research on the yoga and meditation to make our planet a better place to live. These discussions we are having as part of the Ganges-Mississippi dialogue. Ganges, the River Ganga, and Mississippi rivers are thousands of years old. While making its journey from a young glacier-fed river to a mature, slow-flowing life, they have not only shaped the landform, but also the civilizations, leading to the progress of the mankind. The Ganges civilization is the oldest and the most developed and accomplished civilization, and the modern-day American civilization originating from the banks of Mississippi are converging at the American Academy of Yoga and Meditation here in Memphis, Tennessee, where I'm talking to you from. This we are having is a series of dialogue with people as part of an exploration into the nature of this universe and its knowledge systems from a perspective of modern science and Indian philosophy. Today, we are discussing about COVID-19 and impact on kidney health. We have three renowned speakers, Vivek Jha, who will talk about impacts of COVID-19 on kidney health in India. We have Dr. Agarwal, who will be talking on positive impacts of COVID-19. And we have Dr. Shetty, who will be talking about yoga, meditation, and plant-based diet. First, regarding Professor Vivek Jha. He is the Executive Director at the George Institute for Global Health, India. He is the Chair of Global Kidney Health, Faculty of Medicine, Imperial College of London, and the President of the International Society of Nephrology. Professor Jha has wide-ranging research interests, including understanding the health and societal impact of kidney diseases around the world and development of affordable, scalable, sustainable primary and secondary prevention tools. He has worked with many organizations, including WHO, to develop clinical practice guidelines and advocacy papers, has lectured extensively around the world, and is a prolific writer and editor. Today, he'll be talking about how COVID-19 has not only disrupted the healthcare delivery to patients, but how it has affected the kidney patients in India and how the pandemic has actually highlighted the need to develop resilient healthcare systems and crisis preparedness. Dr. Jha, over to you. Thank you.
Thank you, Dr. Pinaka. It's great to be with you. And I would like to, first of all, thank the American Academy for Yoga and Meditation for inviting me to participate in this Ganga, Mississippi dialogue, which is very appropriate. So good morning to all of you in US. And if we have participants joining from India, good evening to you. Let me start by sharing my presentation. Might take a second. Here you go. I hope you're able to see the slideshow. All right, great. So, look, I'm going to expand the scope of my talk to people with chronic diseases and using kidney disease as a surrogate during the time of the COVID-19 pandemic. Now, I'm sure all of you are familiar with these kind of graphs that are produced by a number of organizations around the world. And this particular graph is taken this morning from the Johns Hopkins website. And I understand the colors red and blue have political connotation in the United States, but in this instance, the color red simply indicates the caseloads of COVID-19 in different parts of the world. And as you can see that both your country, which is United States, and my country, which is India, are heavily color red here. And they are the two leading countries around the world in terms of number of cases in one specific country. As things stand today, we are by no means on the downside of the COVID-19 pandemic, and it will be a while before we see the end of it. We have seen really good news in the form of the vaccine appearing on the horizon, and hopefully that will mitigate the widespread devastation the COVID pandemic has caused around the world. Now, just bad though it is, and it has caused untold suffering around the world, and every single death due to COVID is one death too many. But let's just put these numbers into perspective. So far, the number of deaths attributable to COVID in India have been 139,000. But if you put this number against the estimated number of deaths due to non-communicable diseases in India just in the last 4 weeks, those numbers would exceed the total number of COVID deaths by several folds, and let alone the total number of deaths in India due to non-communicable diseases, including chronic disease. For those of you who are not familiar with these kind of graphs, this shows the disease burden in India in the orange, not orange, really brown color here. The line that you see represents deaths and disability adjusted life years due to communicable diseases, maternal, neonatal, and nutritional causes. And the color in purple here indicates deaths and disability due to non-communicable diseases. You can see that these two lines crossed each other somewhere between 1995 and 2000 in terms of the number of deaths, and around the year 2010 in terms of the disability adjusted life years, which means that more people are dying of non-communicable diseases than due to any other cause in India at this stage. This is the same thing that is shown in another form, and you can see that the number of deaths due to non-communicable diseases have continued to increase between 2007 and 2017 in this instance, and the 6 out of top 10 causes of death now are non-communicable diseases, including chronic kidney disease, which stands at number 10 in India. So that's something which is really important. And just to give you another figure, in 2016, about 62.5 million years of lives were lost in India prematurely due to cardiovascular diseases. And you can see the proportional mortality due to different non-communicable diseases on this slide: 27% cardiovascular disease, 9% cancers, 11% respiratory diseases, 26% due to communicable diseases, and 13% due to other non-communicable diseases, which includes chronic kidney disease. Let's now come to COVID-19 in India. So what did COVID-19 do to Indian people with pre-existing chronic diseases, including chronic kidney disease? It reduced their access to essential medicines, it reduced their access to healthy food, and it caused untold economic suffering. As you all know, that India imposed one of the harshest lockdowns in the world, and because of that, a number of people, especially those who go from rural areas in poor parts of India to large cities like Mumbai, Delhi, Kolkata, etc., for in search of work, they had to come back in many instances by walking thousands of kilometers and thousands of miles, and you can see one such figure here. Now, the number of new cases is fortunately showing a decline over the last several weeks in India, but as you can see, it still remains very high, and really, more than most countries in the world, except maybe US. Now, let's use people with chronic kidney disease as one of the surrogates for the impact of COVID-19 on people with chronic diseases. We do know that people with end-stage kidney failure, they need to receive dialysis treatment at dialysis centers every 2 to 3 days. So lockdown or not, if they want to live, they have to visit dialysis centers 3 times a week to receive this life-saving dialysis treatment. But what did lockdown do? It reduced their access to transport, it forced closure of many dialysis units, and it spread fear in the minds of many staff, leading to staff absenteeism, which affected ability to access treatment. Regular interaction and travel with dialysis staff and other patients and caregivers, of course, increases the risk of transmission, which was a big problem in the initial days. And so as a result, we very quickly constituted an Indian COVID-19 Kidney Health Action Group and developed an hemodialysis unit preparedness checklist to help hemodialysis units organize themselves in such a manner as to be able to provide appropriate care to people who needed dialysis in their units. The Indian Society of Nephrology and the International Society of Nephrology also developed guidelines on managing dialysis patients, as was done in US by a number of organizations, including the American Society of Nephrology and CDC. This is a table taken from one of the publications in India, which shows some data about patients who are on dialysis and what happened to them. I don't want to bore you with all these various figures, but will draw your attention just to this one particular section, in which you can see that almost 30% of patients missed one or more hemodialysis sessions due to lockdown, and about 15% of patients actually permanently stopped coming for their hemodialysis, which in this instance tragically means that they are likely to have died, because dialysis is really a life-saving treatment for these conditions. So they paid the ultimate price for COVID-19 even without contracting the disease. And this is the hemodialysis unit preparedness checklist, which we developed very quickly, and it gave advice to hemodialysis units as to what did they need to do and how did they need to advise their patients before they arrived at dialysis centers or nephrology services, and what should the health personnel do. The health personnel also, what should they do upon arrival at the dialysis unit before the patients enter into dialysis area or dialysis room. And finally, after they have entered the dialysis area or dialysis room, there were a set of standard operating procedures that needed to be implemented to make sure that the staff remains fully protected from the risk of transmission of COVID-19 from a potentially infective patient, and also that the patient received safe dialysis treatment while they were there. This information did not remain hidden from the popular news media as well. And as you can see, a number of outlets, in this case, CNBC TV 19, and including on social media, this information spread very quickly on how dialysis patients were suffering because of COVID-19, leading to even deaths. And so what did it do? One of the good things in Indian society is its huge degree of resilience. And we will see that in a moment, but a number of organizations, including some of the research groups that we work with at the George Institute for Global Health, they very quickly swung into action and started providing support to people. This was also actually picked up by large nephrology societies around the world, including the American Society of Nephrology, the European Renal Association, and the International Society of Nephrology. And we are really very grateful to our colleagues in these three societies, including Dr. Agarwal, and at that time, the ERA president, Professor Carmina Zoccoli, for having come together. And our three societies really made an appeal to all the governments and the agencies that are overseeing dialysis centers throughout the developing world to ensure that the staff, the nephrologists, and other health professionals received appropriate support, and so did the vulnerable patients. We also called for government agencies to ensure protection to healthcare workers. So this is, I'll now move to some of the examples of what the civil society did in India. So this is one example of the work that was done by our research team that works in rural Andhra Pradesh amongst people with non-communicable diseases in the rural areas. And they very quickly banded together and worked with the government to organize ambulances to ensure that even during the period of severe lockdown where no transport was available, patients who needed dialysis during those times did not have to wait for getting transport. Our research team also works with people in informal settlements, in urban slums. And what they found is that there was a lot of fake news and information among these communities, which caused fear and panic. And lack of accurate information meant that these communities were unaware of preventive and protective actions to tackle the disease. So our research teams who were already working in these slums for the last 2 years, they started a communication campaign, and they used very innovative methods using comics, posters, and illustrations to raise awareness around hand washing, physical distancing, and masks, etc. And one of the examples is this. Because in the early days, unfortunately, because of misinformation, there was a lot of discrimination against people from the northeastern part of India. And so our team created these kind of posters to combat this kind of misinformation amongst people. So we have a research team which is called Accountability for Informal Urban Equity, which works with waste-picking communities who depend on daily wages, and they did not have any safety net. So we developed information, education, and communication material, and we shared it with these waste pickers via WhatsApp group, which they were part of already. And our partners set up a mental health telecounseling system in Bengaluru, which is currently offering service to community members through a one-to-one appointment with a trained counselor. We also noted that there was a specific adverse impact of COVID-19 on older people who faced a number of social issues. And these social issues are compounded because of lack of policies. And we did aggressive advocacy, which led to a response from the government by release of a national policy on senior citizens. And a lot of non-government organizations and palliative care units, especially in Kerala, became active in providing support to these senior citizens who were particularly vulnerable in the times of COVID pandemic. Our healthcare community also very quickly became adept in providing home monitoring, and specifically home monitoring for patients with kidney disease was facilitated by the use of smartphones, and asking our patients to get these 4 essential equipments by which they could do self-monitoring and share this information using specific apps through the smartphone with their healthcare providers. And these were thermometers, a pulse oximeter, which measures the oxygen concentration in the blood, a glucometer for patients who had diabetes in order to measure their blood glucose, and a sphygmomanometer or blood pressure instrument. So there are a number of things which went wrong, but a number of things that went right as well, and our society could quickly respond to this. And so, in the end, I would just say that the practicing doctors have accumulated a lot of lessons, which are summarized here. The value of implementing and following strict infection control measures, which is very important in the kidney health community because we manage patients on dialysis who are vulnerable to getting infections. The value of having universal and rapid tests for COVID virus, being on the lookout for atypical cases, also prepare for logistic challenges because of interruptions in supply chain, etc. Making sure that we have adequate supplies, implement shared decision making by talking to our patients, encouraging switching to home therapies, and becoming proficient in virtual care. With that, I'm going to thank you, and I will be very happy to take any questions.
Dr. Jha, thank you so much for a wonderful presentation and educating us about the challenges we all went through during the initial wave of the COVID. Obviously, the pandemic has highlighted the need to develop some resilient healthcare systems and also crisis preparedness. Well, as a paradox, we have some good things that has come out of this pandemic that we have learned. Our next speaker is Dr. Anupam Agarwal, who is the Director of Nephrology Research and Training Center, and Thomas E. Andreoli Professor of Nephrology at University of Alabama, Birmingham. He has received numerous local and national awards for outstanding contributions to nephrology research and teaching. Today, he will be talking to us about how COVID-19 pandemic has brought unparalleled challenges and has disrupted everyday life throughout the globe. Even in these difficult times, there has been many good things that has come about from this continuing experience that we should cherish and learn from. Several of these good outcomes from the pandemic will hopefully stay long after the pandemic is over and will be discussed now in this presentation. Over to you, Dr. Agarwal.
Thank you, Dr. Pinaka. It's really an honor to share the podium with Dr. Shetty and Dr. Jha, colleagues that I've known for over 3 decades. So thank you for the invitation by the American Academy of Yoga and Meditation. So can I have the first slide, please?
We have some technical issues here with the slides, waiting for the technical team to help us with Dr. Agarwal's slides over here.
Thank you for your help, Anjali. There we go. Thank you. So the next slide shows my disclosures. None of them have any relationship to my talk today. I serve as the current president of the American Society of Nephrology and other disclosures. Next slide, please. So Dr. Jha just showed you some of the major issues that we faced with the COVID pandemic in India. And this slide just shows you where we are as of last night, at least the US time. The daily cases in the US, you can see we've not just seen, first, second, but a third peak. We've never gone back to normal, and the deaths are significantly increasing. The hospitals are absolutely getting taxed. I know just this morning, US time, I just got census from our ICUs. We are overflowing, with patients, and it's just becoming really a crisis mode. In the next slide, and you all saw this figure, this image that Dr. Jha showed in his presentation with the worldwide pandemic. So clearly, this has been absolutely challenging and unparalleled time in our history that we will be telling our children I mean, our grandchildren, in the next coming decades. Next slide, please. And we've seen, images such as these. So this is an image from India earlier on in the pandemic. And in the next slide, you will see these graves, mass burial graves from Brazil, and similar occurrence in a lot of different countries, how the system was absolutely taxed with the pandemic. Can I get the next slide, please? So this is where we are, again, as of last night, 65 million cases worldwide, 1.5 million deaths, but a lot of patients that have recovered. So at least the silver lining is these patients that have recovered hopefully won't need a vaccine, that their immune system would have developed antibodies, and they would be spared, the need for a vaccine, and maybe we could use it for other vulnerable, people across the world. So next slide. So a lot of good things have actually come out of this COVID pandemic. It's almost, some could say that this could be controversial to say that. But if you look at some of the positive general, things that I would like to mention in terms of the positive impacts, those are shown on this slide here. The community spirit that was built around this pandemic was simply amazing. We all saw, how people came about to appreciate essential workers, whether it was teachers or healthcare workers, nurses and doctors and others who work in the hospitals. There was resounding appreciation for them across the world. A lot of distilleries that were making alcohol, started making mass producing hand sanitizers. A lot of people realizing that fresh air was important, got outside and became more active. People started getting more in touch with family and friends. And they did some analysis of Fitbit users, and it turns out that people were sleeping better despite the scare, of this pandemic. And if you see the environment in the next slide, this shows you a satellite image from NASA and the European Space Agency monitoring pollution across the globe. So you can see on the left panel, in early January, over China, the nitrogen dioxide levels were very high, particularly around the big cities, Hong Kong and Shanghai and Beijing and others. But you see, just a month later, in early February, with the really massive lockdown that first started in China, there was significantly reduced nitrogen dioxide emission into the atmosphere. And these images were captured across the globe as the lockdown started occurring, not only in China, but in India, in the United States, and several other countries. And I'll show you in the next slide is an image from the Ganges River. So this was reported in the BBC, where they looked at pollution in the Ganges River had significantly reduced because of the lockdown. In fact, on the next slide, some investigators actually looked at the turbidity and did a satellite analysis of the Ganges River and found that the turbidity of the Ganges River was markedly reduced during the lockdown period due to the COVID pandemic. So clearly something good with the lockdown, that it cleaned up the Ganges River. And similar stories have been reported from across the globe, in the Mississippi River, given that this is a Ganges-Mississippi dialogue. Similar reports were from the Ganges River. The major lakes all across the world had similar findings, that the water was a lot purer. And if you can show the next slide, this is a picture from Venice. So the canals in Venice were crystal clear. You could actually see fish in the water, which normally you would never see. So this was amazing, how the canals in Venice were so much more clear compared to what you would otherwise expect. So we know that the lockdowns had created, havoc in terms of the economy. So this is Times Square in New York. I don't know when you would have seen Times Square like this, probably after 9/11, when the destruction of the World Trade Centers occurred. But this is a rare occurrence to see Times Square so empty. However, nephrologists have been very busy even during the lockdown. So shown in the next slide is clinical productivity of nephrologists in a hospital in the New York area. So you can see here in the purple on this graph is the data for number of hospital admissions in 2019. And in the yellow are the hospital admissions in 2020. So the shaded area in the blue here represents the lockdown initially in March in the New York area. And you can see on the next slide, nephrology consultations dramatically increased, even though the number of patients that were coming into the hospital were decreased, the consultations for nephrology markedly increased, as you can see on this slide. And the requirement for dialysis in the form of CRRT, or continuous renal replacement therapy, was increased about threefold during this pandemic, while the hospital admissions, you can see, were quite similar. This just highlights that, in a way, this was good for nephrologists, that their productivity increased significantly, but it did cause a burden on the workforce in terms of need for nephrologists, need for dialysis supplies in particular areas in the New York area hospitals. And we worked very quickly with major dialysis providers to help alleviate those needs during the pandemic. Fortunately, in this more recent surge, we are not seeing as much in terms of kidney complications or even lung complications for that matter. We're not really certain why that is the case, but maybe younger patients are getting infected that do not have a lot of comorbid conditions. We are uncertain at this time, but that may be an interesting research study to undertake. Next slide. So my colleague Rajiv Agarwal from Indiana University wrote this beautiful article highlighting the positive impact of COVID-19, titled "The Aftermath of Coronavirus Disease 2019, Devastation or a New Dawn for Nephrology." And as shown in this nice schematic on the next slide, what he showed was this pandemic has opened new doors in terms of collaboration, innovation, telemedicine, dialysis delivery, virtual learning, disaster preparedness, infection control, social determinants of health, and also new research in these areas. So in the next few slides, I'll take some of these and share examples of how this pandemic has had a positive impact on some of these important components. So the next slide will show you how this pandemic has really fostered collaboration, not just in the United States, but I think across the globe. And Dr. Jha just showed you an example of how three major societies in the world, the International Society of Nephrology, the European Renal Association, and the European Dialysis and Transplant Association, and the American Society of Nephrology got together to really push governments to make sure that dialysis services continued during this time. Very early in this pandemic, there were reports in the lay media that patients who were taking cardioprotective drugs or for hypertension, namely angiotensin converting enzyme inhibitors and angiotensin receptor blockers, should stop these drugs because they could be harmful in patients with COVID-19. So why did that come up? So that is fundamental to how this virus infects, and that's shown on this slide here. So COVID-19, the coronavirus, has a spike protein which attaches to the ACE2 protein. And this ACE2 protein is abundant in the lung as well as in the kidney in the proximal tubule. So in patients taking ACE inhibitors or angiotensin receptor blockers, as you can see on the right side of this figure, if you can go back to the previous slide, thank you. You can see if you block these, the conversion of angiotensin 1 to angiotensin 1 through 9 or angiotensin 1 through 7 is increased because of these increased levels, and the enzyme that does that is ACE2. So the hypothesis was that if you have these agents, if you're taking to inhibit your angiotensin-renin system, that the ACE2 levels would be higher. Therefore, if you get the virus, you will have more entry of the virus into your lungs and kidneys, and therefore you'll have worse disease. Shown on the next slide is very elegant work that was done as a collaboration between multiple investigators, mainly Matthew Sparks, Swapnil Hiramath, and others, who highlighted very quickly that these agents are very important for cardiovascular protection and management of hypertension and progression of chronic kidney disease, that you should really not stop these medications, and that the fact that this agent may worsen COVID-19 is actually not true. And this was supported by multiple societies across the world as well, both nephrology societies, cardiology societies, and hypertension societies. And more recently, there have been multiple publications, including in the New England Journal of Medicine, that actually corroborated these early findings that debunked the hypothesis that these drugs cause problems in COVID-19. So if anybody of your patients are on these drugs, please encourage them to continue these agents, that these are not contraindicated during this COVID pandemic. On the next slide is another report very early from China. They said that, kidney involvement is not very common in COVID-19 patients, and this began appearing on social media. But as the pandemic started going out from Wuhan, China, to other parts of Europe, Italy, India, United States, and so on, it became very clear that the kidney was significantly involved during this pandemic. And another great collaborative effort here, led by Dr. Jha and others from South Africa, from Taiwan, from China, and from India, were one of the first to demonstrate the epidemic at that time, which became a pandemic, caused on the kidneys, highlighting that kidney involvement was significant in COVID-19 patients. And shown on the next slide is work, again, collaborative work by Dr. Swaminathan and others, demonstrating the actual pathophysiology of how COVID-19 causes acute kidney injury, and really highlighting that understanding the pathophysiology could highlight how we could potentially intervene and reverse this condition. So if I can have the next slide, I'll share with you some examples of innovation, how this pandemic has driven innovation in a real time of a difficult time that we are all facing. Shown here on the slide is this rapid test that was developed by Abbott. It's called ID Now, that in less than 5 to 10 minutes, you can have a test done at a point of care, whether it's an emergency clinic or an emergency room or an outpatient clinic where you're seeing a patient. For a negative test, it takes about 13 to 15 minutes. So this has been a remarkable, and the speed at which these tests have been developed have been really unbelievable. And shown on the next slide is this pioneering work from an Indian scientist from a company called My Lab, Dr. Minal Bhosle, who was a virologist, and she developed a very inexpensive test for COVID-19. And ironically, the day she delivered the test for validation to the National Institute of Virology, she actually went into labor and next day, had a child. So really amazing innovation and invention by this virologist from India, a low-cost, extremely low-cost test that was developed by her, and it was also a rapid test. So really remarkable innovation that was spurred, by this COVID-19 pandemic. Next slide, please. And shown here is work that was done by the Department of Defense in the United States, the Operation Warp Speed, that put billions of dollars into industry to speed the process of vaccine development. Given all the new technology we have right now, in the past, the vaccines that were developed for measles, rubella, polio, smallpox, they took an average of 10 to 15 years to develop and validate. But with this Operation Warp Speed, I think we will hear very soon, at least in the United States, approval of the Pfizer vaccine on December 10th, and distribution of this vaccine across the country and across the globe. And it has already been approved in the United Kingdom. The hope is that these vaccines would have dramatic effect on rendering herd immunity in the population, that we could hopefully reverse the bad trend of this virus by at least summer or fall of 2021. Still a daunting task, but at least that we have a vaccine already within 10 or 11 months of the pandemic, I think is exceptional discovery. Next slide, please. Let's talk about telemedicine. We've had telemedicine for a while. This is my colleague at UAB at my institution. He's the director for our UAB medicine program, Dr. Eric Wallace. And over 5 years ago, he had developed telemedicine to take care of our peritoneal dialysis patients who may be living 4 or 5 hours away, that they did not have to come to our clinic, but we could do a televisit and get it reimbursed. And very quickly, as shown on the next slide, we received overnight approvals from CMS for telemedicine. I was invited to the White House for a meeting with the COVID-19 task force with Vice President and President Trump on March 18th, and we highlighted that dialysis patients sat next to each other 2 feet away, and they were high-risk, vulnerable populations to get COVID. In fact, the first 2 patients in Washington state that died were both dialysis patients in nursing homes. So they heard us, and Vice President Pence actually said, Dr. Agarwal, by tomorrow, we will have changes in telemedicine that you can see your patients in dialysis units by telemedicine, and you would be reimbursed for that visit. So those really transformed how we could deliver healthcare. And you can see here, this is just an example from our clinic at my hospital. In the red, the first bar is pre-COVID, February. All the visits were done by in-person visits. And you can see in March and April, the inpatient visits dropped significantly. And the green is telephone and the purple is video visits. And you can see they dropped significantly, but we kept our volumes up. And the only way we could keep our volumes up and deliver patient care was through telemedicine. And we are now completely back up to, actually, we've exceeded our earlier volumes because patients like the telemedicine approach, unless they have to come in for a surgical procedure and so on. Telemedicine has really been transformational and something that probably will stay beyond the pandemic in terms of how we can take care of our patients during the after the pandemic. Shown you on the next slide, let's talk a little bit about how this pandemic has affected education. So we all know we've not had any in-person conferences anymore. All the conferences have been virtual. It clearly allows for broader participation. Low-income countries, people can participate, particularly the trainees. They don't have to fly across the oceans, incur costs on traveling, incur costs for hotel stay, and cause an inconvenience to their families. There's no limited time. These are all recorded, so you can watch it, in your pajamas from your home. A lot of interviews that have been done. We just completed our interview season for our fellowship positions for nephrology, and those were just announced earlier this week on Wednesday. And next slide. And this pandemic has had an important influence on increasing nephrology fellowship applications, at least in the United States. There has been a decline in interest in nephrology in the past 5 to 10 years. And whether it's due to the pandemic, we're not completely sure. The fact that nephrologists are frontline workers has changed that paradigm, that we saw significant increases in nephrology candidates and total applications by over 50%. And our match results have also exceeded the usual 60% to about 73% in terms of fellowship programs that filled. Next slide. And this just shows you the international medical graduates were increased as well as US medical graduates, while DO applicants were flat or actually slightly decreased. So these data are from the American Society of Nephrology and will be published soon. So what about disaster preparedness? So this was a great example. We learned a lot from the Ebola, epidemic in early, 2012, 2013. This pandemic has allowed us to learn how to plan, how to prepare, and what do we do during the recovery phase, which unfortunately hasn't started yet. So if I can have the next slide, you can see that we learned that a lot of our stockpiles were not adequate for personal protective equipment, whether it's masks or gowns or ventilators or dialysis machines, dialysis supplies, healthcare workforce itself. Do we have enough healthcare workers, nurses, technicians? A lot of healthcare workers were getting sick and had to be quarantined, so we needed to have backup support. A lot of patients who were on home dialysis did really well because they were managing their own dialysis. So we learned a lot from preferred ways of treating patients, and Dr. Jha alluded to some of the benefits and how they tackled dialysis in India, which was a huge issue, but we worked around it, and really the home patients did quite well during this pandemic. So I'll end by the next slide here, just summarizing. Clearly there is no doubt that this COVID-19 pandemic has imposed tremendous stress and disrupted life. But it has a global impact on our economies, on mental health, and clearly has caused untoward suffering. But there have been some silver lining. I think many positive attributes, some of it that I've shared with you in my presentation, and hopefully some of these will stay after the pandemic is over. So thank you very much for your attention, and I'm happy to take any questions.
Dr. Agarwal, thank you so much for a wonderful presentation. And this did highlight all the positive impacts of this pandemic, while we see our personal relationships among humans improve, the nature recovering and recovering its glory, and also all the transformational changes that has happened. Hopefully that stay with us for a longer time. And more so in the US, the gentle push for home dialysis, hopefully this will turn around and help not only the nephrologists, but the kidney disease patients also. Our next speaker, Dr. Anupkumar Shetty, is a nephrologist with Dallas Nephrology Associates in Texas, USA. He's also Associate Director at Nephrology Fellowship Program with the Methodist Dallas Medical Center. He has a very interesting topic today. He'll be talking about plant-based diet for kidney health and overall health. We will have quotes from Treta Yuga, Dwapar Yuga, and also contemporary literature from Kali Yuga. He'll be stressing on moderation and try to bridge contemporary literature with spirituality that is eternally current. Dr. Shetty, over to you.
Thank you, Jyoti. And thanks to everybody in AAYM, and thanks to the prior speakers, both Anupam and Vivek, for leading nephrology in the world. So this is my disclosure. none that are relevant to today's topic. So I initially want to talk about the gravity of the situation and the disease burden that we are facing today, and then go into what we can do about it, mainly focusing on the food consumption. As you see in this slide, Southeast Asia is India and the neighboring countries. We have tremendous disease burden in terms of chronic kidney disease compared to the rest of the world. And the interesting thing is kidney disease is rarely a single system disease. The most of the kidney disease comes from systemic illness, and kidney happens to be one of the organs involved. And when it comes to kidney failure, the large majority of kidney patients suffer from diabetes mellitus and hypertension. So if you want to prevent kidney disease, you want to prevent the cause of kidney disease, which is diabetes and hypertension. And as you all know, diabetes and hypertension are largely lifestyle illnesses. If you look at this busy slide, it gives you the burden of diabetes in the world. And this is Southeast Asia. This is North America. And here we see 48 millions currently, and it's expected to go up to 63 million in 2045. Compared to that, India has 88 million diabetics, and which is expected to go up by 74%. As you can see, compared to North America and compared to Europe, we expect big increase in the burden of diabetes in India, Middle East, and Africa in the next several decades. And it's going to pose a huge economic burden on all these countries, and it might be just impossible to take care of these many patients. When we talk about burden of diabetes, we are not just talking about insulin and pills. We are talking about the end organ damages, and the care for end organ damage, such as dialysis, heart attack, strokes, is huge compared to taking pills and insulin for diabetes. And it costs a whole lot less to prevent diabetes. If you look at deaths attributable to diabetes in 3 big nations in the world, as you see, the deaths related to diabetes has slightly increased over the last 10 years in India. It has gone down in the United States, and it has gone up more in China. So there is an immediate need for lifestyle revolution in India and most parts of the world. So in the next few slides, I'm going to talk about why do some people are well and some people are not well. In other words, what are the logistics of wellness and illness? This is a busy slide where I have merged some spiritual teachings and some contemporary science. What you see here is 5 sheets described in the yoga literature and spiritual literature, where we have 5 sheets: Annamaya Kosha, which is related to physical health; Pranamaya Kosha, which is pranic health or life energy science; Manomaya Kosha is mind sheath, and intellectual sheath is Vijnanamaya Kosha, and Anandamaya Kosha is the sheath of bliss. And as you spiritually advance, you go through the sheaths to experience bliss. Talking about integration, the world is made of these 5 elements: earth, water, air, fire, and ether. And our body is a mini world consisting of same earth and same water, same air, fire, and ether. And if you look at the interventions that one can do or one does on a day-to-day basis, solid food is earth, liquids is water, breathing air is air, digestive juices and hormones represent fire, and emotions and bliss, happiness, is ether. So there is a mini world inside the body with these five elements, panchadhatus. If you look at the next slide, our health is a byproduct of these 5 elements. If you have healthy food, healthy water, clean air, clean emotions and spices, clean fire, and equanimity of mind, you come up with a healthy body, healthy individual. On the other hand, if you have unhealthy food, sugary drinks or alcohol, polluted air, including smoking, extremes of taste, and extreme of stress, then you end up with an unhealthy body. If you look at the 8 angas, 8 wings of yoga, you see that yama and niyamas, talking about the ethics of life, the do's and don'ts of life, and then asanas, addressing physical activity, physical exercise, stretching, and then pranayama, which is breathing exercise plus plus plus, and then pratyahara is withdrawal from unnecessary things, and dharana and dhyana are kinds of meditation. One is intermittent meditation and one is continuous meditation, which eventually ends up in samadhi. Now, I kept this going a little bit below rest of the squares, just to indicate that it may be a little bit more than just health. But this is addressing physical health, mental health, and intellectual health. So if you look at one of the Yoga Sutras, it talks about how to develop any discipline in life. And to develop any discipline in life, it has to be Dirgha Kala, Nairantarya, Satkara, and Sevito. It's Dirgha Kala is persistence for long period of time. Nairantarya is everyday practice. Satkara is respect to that practice. And here Sevito, it refers to doing everything and anything as a service to God, service to that Supreme Being in whatever name you call it and whatever unnamed entity that you call it, but do everything on a daily basis for a long period of time with respect to it and with reverence to it. And when we do this Sevito part is extremely important, because whenever you do something, whenever you eat something or drink something or breathe something as service to God, there is no way you're going to do anything wrong. Now, why plant-based diet? Like Jyotishri said, I'm going to talk a little bit from Treta Yuga, a little bit from Dvapara Yuga, a little bit to Kali Yuga, just to keep it interesting and relevant. Now, this is from Ramaraksha Stotra. This was not necessarily written in Treta Yuga, but it refers to Treta Yuga. And it goes as Phala Mula Sinau Dantau tapasau brahmacharinau putrau dasharatasya tau bhratarau Rama Lakshmanau. I think I made a mistake in pronouncing, but what it means is it's referring to Rama and Lakshmana, the two brothers, the sons of Dasharatha, who are subsisting on roots and fruits and practicing penance and celibacy. These are some of the things that we need to do to be healthy. Going to Valmiki Ramayana, it has a reference to Sri Rama telling Guha, again stressing him that know me as under a vow to be an ascetic, wearing the robes of bark and deer skin, and by piety I am determined to live in the forest by eating roots and fruits only. Now there is a controversy as to whether they ate meat before that or not, but that is out of context today, but I just wanted to refer this to you. And coming over to Dwapara Yuga, in Bhagavad Gita in chapter 17, which talks a lot about healthy eating, which fits into people of different lifestyle. I just took one verse. So this refers to the sattvic individuals. It talks about the food, talks about ayuhu, sattva, bala, arogya, sukha, priti vivardanaha, rasya snigdaha stira hradya aharaha satvika priya. So this is talking about what makes people sattvic. It's a interdependent thing. It talks about what sattvic people do, and it also talks about what makes people sattvic. So the literal meaning of this is persons in the mode of goodness prefer foods that promote the lifespan, that is ayuhu, sattva, virtue, bala, strength, arogya is health, sukha is happiness, and vivardhana, satisfaction. And such foods are juicy, succulent, nourishing, and nurturing. And going to next slide. So just to go to the practical meaning of this rasya, that is juicy food. Snigdha is something with little bit oil in it. Stira is something that remains stable. And something is hridya, I think it refers to something, I don't know the meaning of that, when it refers to the heart. But in practical sense, these are fresh foods, juicy foods, foods that stay fresh, foods with little bit of oil, and foods that remain stable. So it kind of even refers to pickles and yogurt, which are sources of probiotics and antioxidants. It refers to gentle use of oil. It refers to fruits and vegetables. Now, in other parts of Bhagavad Gita, it talks about different ways of eating. Certain foods are to be chewed, certain foods are to be drunk, certain foods are to be licked. For example, honey. Honey is popular now. It's coming back. Everybody says honey is healthy, ghee is healthy. Yeah, they are healthy in small quantities. So something to be licked like honey is not to be drunk. So moderation is adoration. That's what my friend Dr. Raju says, and he's the one who helped me with some of these shlokas. And moderation is adoration, and it's extremely important. Now, nephrologists we take pride in being good internists, and I can't separate kidney health from the rest of the body. And I just picked a few slides on how vegetarian diet impacts heart health. And this is from Dean Ornish, who has been publishing since the 70s. And now he has a healthy heart program to reverse the coronary artery disease. And he did an interesting study where a group of people were prescribed low-fat vegetarian diet, moderate aerobic exercise 3 hours a week, stress management techniques. Actually, interestingly, Dean Ornish was trained by one of the gurus called Swami Satchidananda, and he stopping smoking was the other intervention, and group support twice a week was actually it was I think 4 hours twice a week to these people. So it was not just that; it was a whole package that he exposed these people to. And to make the presentation very short, those who adhere to the plan, they actually did coronary angiogram before and after in small number of people. And in those who adhered to the plan, the percentage of change in diameter was more compared to those who did not adhere. And this is in the intervention group. If you take the whole group, those who didn't adhere, actually their narrowing of the arteries increased. Now, for the healthy kidneys, there are different ways that the diet affects the kidneys. The plants are rich in fiber, low in lipids, and low in protein. And the nature of protein also is different. And because of that, the fiber improves the glycemic control in diabetics. It increases insulin sensitivity. It helps with cholesterol. It reduces the urea and creatinine levels. And I will show you a few slides showing that it actually decreases the progression of kidney disease, which may be related to better blood pressure control, less inflammation, and many other things. If you look at the vascular endothelial cells, which is the inner layer of blood vessels, the plant-based diet affects at different levels, favoring overall health, especially kidney health. It works at the vascular endothelial levels. It works at the vascular endothelial injury, causing more oxidation of LDL cholesterol, which is considered the bad cholesterol. And it also works at the level of the inflammatory cells. If you look at this study, they studied the gene expression of pro-inflammatory substances, and over 1 year, they found downregulation of expression of these pro-inflammatory genes in people who practice low-fat vegetarian diet, 18 minutes of physical activity per week, and stress reduction classes. Now, plant-based diet works by helping with hypertension, helping with the control of diabetes, and also helping with weight management, weight control. And this extrapolates as progression of or decreased progression of kidney disease by different mechanisms. Now, plant-based diet also helps with metabolic acidosis. For the non-physicians in the audience, the acid level goes up in kidney patients, and plant foods are generally alkaline and it neutralizes. Kidney patients accumulate phosphate, and plant-based are lower in phosphate, and even the plant foods that are high in phosphorus, that phosphorus is less available to the body. In other words, bioavailability is low. It helps with hypertension, cardiovascular disease. And the other important thing is the uremic toxin, that the toxins that accumulate in kidney patients generally come from the food that we eat. And usually meat-based food produces more toxins compared to plant-based food. And also the fibers that are in plant-based food, they bind to uremic toxins and do not allow them to get absorbed. And also plant-based diet favors the gut microbiome, that is the bacteria, the healthy bacteria in the gut, which actually eats these uremic toxins themselves. This is one of the studies done by Dr. Goraya and Dr. Wesson in Texas. They did a small study in people with kidney function between 15 and 30%, that is stage 4 kidney disease. They 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 gave unlimited amount of fruits and vegetables to one group. They not only gave free food to them, but they also gave it to their family members. That way they won't distribute, spread it through the family. And one group treated them with the baking soda, sodium bicarbonate. Other group was treated by usual care. And what they found is in these two groups, their alkali level normalized and their rate of loss of kidney disease was less compared to the general group, and the blood pressure control was better in the group that was treated with plants and vegetables compared to the other group. If you look at this is from the same study. The rate of loss of kidney disease was less in people who were treated with plant-based diet and actually even baking soda compared to those who received usual care. Now, this is another big study of 14,000 plus people who were followed up from the 80s till recently. It's called atherosclerosis reduction in community study. So as the name says, it was not necessarily focused on kidneys, but this was a ad hoc analysis. And they scored different kinds of diet. The main point in this is not all the plant-based food or not all the vegetarian food is healthy. So healthy plant-based food is healthy, but you can make plant-based food unhealthy as well. So this is unhealthy plant-based food with sodas and sweets and chocolates and things like that. And this is the healthy food where you have fruits, vegetables, and nuts, and coffee and tea in moderation. And as you see, the incident CKD was less in those who had mainly healthy plant-based diet, and their GFR decline or decline in kidney disease was less compared to the rest. And this p-value less than 0.05 is considered significant. Even though these numbers do not look that different, it's in big population, it makes a big difference. This is another study where they gave plant-based diet to people with advanced kidney disease who were almost ready to be put on dialysis. And what they found, one important thing is those who were treated with that, you did not cause malnutrition. In fact, malnutrition is more common in people who were treated with dialysis. The cardiac deaths were more in people who were treated with dialysis. And so, in other words, even in advanced kidney disease, there is place for plant-based diet. Now, there are concerns that plant-based diet may be high in phosphorus. Actually, the nuts are high in phosphorus, but the phosphorus in nuts is not as bioavailable as the phosphorus in meat-based diet. So in the studies, they have found that low phosphorus excretion in people who were treated with plant-based diet, indicating that they absorb less phosphorus. And in the hemo study, which is a large dialysis study, they showed that low phosphorus intake actually was a poor intake. So hyperphosphatemia is not really a concern. Same thing with hyperkalemia. Hyperkalemia is high potassium. Plants and vegetables have high potassium compared to the other food, which are non-plant based. But studies have shown that those who are treated with plant-based diet do not necessarily have problem with potassium. So the if you look at the renal diet, if you Google it, for a long time, the first thing that used to come was renal diet prescribed by or put in the website by one of the large dialysis vendors, Davita. So, but most of the kidney patients that I see, and most of the kidney patients that most of the kidney doctors see, they're not necessarily dialysis patients. They're people who are trying hard to prevent dialysis. So people who are not on dialysis, they don't need to be on dialysis patient's diet, which is called renal diet. But there is nothing like renal diet that is good for all kidney patients. And for that reason, most kidney patients who are not on dialysis, they can eat moderate amount of plants and vegetables. And they can eat high phosphorus food, they can eat high potassium food in moderation. This is an example of a plant-based diet. So it is 2 to 4 servings of fruit, roughly, and moderate size apple is considered 1 serving. 5+ servings of non-starchy vegetables. Handful of vegetable is considered 1 serving. So 5+ servings of non-starchy vegetable, which means at least 2 servings of sabzi, 2 servings of vegetables in each meal. And non-starchy is a key word here. In other words, the potato is not considered vegetable. Okay, it's starch. Corn is not considered vegetable. It's starch. Okay, rice and wheat, they are plant-based starchy food. They don't come in this category. And you want to have 2+ servings of whole grains and starchy vegetables, and 3+ servings of legumes as source of proteins, and some nuts as source of proteins. So you have legumes and nuts as source of proteins. You have starchy food. You have fruits and vegetables. I tell my patients elephants and horses are vegetarian animals, so you don't need meat to be strong. Things to avoid: fruit juice. Fruit juice is not same as eating fruit. It just is a bunch of sugar and water. And vegetable sauces come with a lot of additives and salt, and they lack fiber. So I think strongly that we should avoid fruit juices, and we definitely should avoid sodas, the Coca-Colas of the world, the Thumbs Up, the Pepsi, and even non-carbonated drinks like Mangola and all the other sugary drinks. And we should avoid meats and dairy. I cannot say we should avoid. Most Indians are dairy products are big source of protein for Indian diet. So I don't think that strongly that we should avoid dairy, especially the paneer and the Indian cheese that most of us like. This is a plate that I took picture of after I ate some of the fruits already. But the main thing is your plate, more than half of your plate should be filled with vegetables. And this is my final slide. So there are different benefits of plant-based diet to the kidneys and overall health, including diabetes, hypertension, and obesity, and heart health. You want to mix fruits, vegetables of different colors, and you want to go nuts sometimes, you want to go bananas sometime of the day, and eat healthy and moderate food, and be happy, sleep well. Thank you. That's my last slide.
Thank you so much for a wonderful informative and educational session. regarding the impacts of COVID-19 on kidney health, and also with the yoga, meditation, and plant diet. Dr. Jha, Dr. Agarwal, and Dr. Shetty. Now let's move on to take some of the audience questions. I have two questions I'll ask both together paradoxically. Question number one is, can COVID-19 cause kidney failure and in turn the need for dialysis, that CRRT, in otherwise healthy normal adults? Question two is, what about the patients who already have chronic kidney disease? Are they at risk for acquiring or getting COVID-19?
Anup, do you want to take that? Or?
Sure. So the first question is, I already forgot the first question. This is about
Can a normal person get COVID?
Yeah.
And kidney failure without any risk factors?
Yeah, the answer is yes. The kidney, like I said earlier, in chronic kidney disease, usually is an innocent bystander. So whenever you get sick for any reason, there is a high possibility that kidney will get involved. Now, in addition, there are some specific mechanisms by which COVID affects. One of the things you all might know that people with COVID tend to clot easily, and there are some ways that kidneys get affected by mechanisms of having tendency to clot easily and having also injury to the blood vessels. Kidney is actually a bunch of blood vessels trying to clean the blood, and whenever you have something damaging the blood vessels, it's likely that kidney is going to get affected. So the answer is yes. Now the second question was, do people with existing kidney disease, are they at higher risk? Generally, sicker you are at higher risk of getting affected with COVID. So I don't want to scare the people in the audience, but kidney disease is no exception. So yeah, it does put you at higher risk of getting sick from COVID. And now, just to reassure you, if you are a patient, you have to look at yourself and not look at the statistics. And nobody has 100% chance of getting sick. And so you have to put yourself in the category of people with lower risk. In other words, you have to reduce your own risk by eating healthy, being happy, wearing mask, and staying away from shared air. So avoid crowds and avoid breathing air that other people have exhaled. So that is my answer. Thank you.
Thank you, Dr. Shetty. And with so many changes and healthcare disruptions that has happened, and help from the government, the community, and all the NGOs, what action should people take who themselves have chronic kidney disease, especially during this pandemic? Not just those for dialysis, even the chronic kidney disease patients.
Yeah, I would say really, as Dr. Shetty emphasized, it's really critical to do the traditional measures, wear a mask, make sure you wash your hands, hand sanitizers, or just with soap and water, really social distance, don't, get into large gatherings, stay home as much as possible if you can telework or work from home. Really, those would be, and then make sure you take your medications. If you're on ACE inhibitor or an ARB, take those medications. Those are not contraindicated for patients with even for the fear of getting COVID-19. So that's important to continue taking. So I wouldn't say you just have to be a little more cautious than an extra, additional person. And even though you may be young, it doesn't preclude you from getting COVID. This is a very contagious virus. So you have to be extremely careful. And just by following the routine, public health measures, I think you could be safe and not contract the disease.
Thank you, Dr. Agarwal. And also, as the CEO from the American Academy of Yoga and Meditation, I would like to inform that we have a monthly newsletter. You can view them online at aaymonline.org. And I would like to take this opportunity to thank our sponsor, NAZone, and thank all our speakers, Dr. Vivek Jha, Dr. Anupam Agarwal, and Dr. Anupkumar Shetty. And as you see in the ticker below, we have the upcoming next webinar on December 12th regarding the mental health at same time, 8 p.m. IST, Indian Standard Time. And thank you, everybody. Namaskar.
Thank you. Thank you. Thank you.
Thank you.
Hello everyone, welcome to an organization where we groom innovation, design future, celebrate ideas. We are the infrastructure backbone of Northeast, where hard work, innovation, and quality matters. We have been successfully leading the industry since 1984. Here is a brief history.
To our first plant at Guwahati. We started production in 1984 with the blessings of Union Commerce Minister Porno Sanwa. There was a need to be near the raw material. We moved closer to the steel plants by opening a plant in the early 1990s in Kolkata. To export our potential, we began Nizon Strips Limited. 50% of the plant's output were exported. Encouraged by the success of this plant, we opened 3 more mills in the same plant. Our products reached. We were global now.